All my colleagues' cooperation on a hectic morning. Senator Crapo, Senator Barrasso is next.
Thank you very much, Mr. Chairman. Mr. Secretary, thank you. I wanted to follow up on something that Senator Crapo asked a little earlier, and that's in terms of the Department of Health and Human Service implementing several emergency waivers for Medicare and Medicaid programs in response to the COVID-19 situation. Some of the waivers have granted patients more flexibility, like enhanced access to telehealth. Others have ensured that providers can do their jobs with less red tape and with more financial certainty. All those things are positive. The world today is very different than it was when the virus first hit our shores. Cases, deaths, hospitalizations are right now much, much closer to pandemic lows. This is why in Wyoming and most of America, life has returned to normal. I think it's why we must plan for the end of the public health emergency. And for us here in Congress, that means we need to ensure that providers and patients don't unexpectedly have the rug pulled out from under them after these flexibilities that I think have been helpful in Medicaid and Medicare after those end. So will you commit to providing detailed and specific information to Congress on those emergency flexibilities that you did use in Medicare and Medicaid and the CHIP program as a result of the pandemic?
Senator, absolutely committed to working with you because a lot of those authorities will vanish and we need to work together to make sure we deploy what we know has worked.
So, and will you provide detailed information on emergency waivers that your department believes Congress should extend or make permanent beyond the public health emergency?
We look forward to working with you on that as well.
Great. Additionally, has your department specified plans to ensure that providers and patients are aware of some of the changes to Medicare, Medicaid, and the CHIP programs when the emergency actually ends?
We have, Senator, but you know what? You could help us a great deal if you continue to let your state leaders know that we're trying to make sure we're communicating everything that's around the bend. And so whether it's the Medicaid wind down or whether it's what happens to those authorities we have for telehealth, we want to make sure everyone has full sight and we're working together to make sure we accommodate.
And Senator Warner before me talked about rural hospitals, and I want to continue on that because, as you know, I practiced medicine in Wyoming for over 20 years, and we've discussed previously ensuring patients in rural America have access to health care in a very it's a personal priority of mine to make sure people get what they need in rural communities. And rural hospitals have really been on the front lines of the pandemic. The facilities provided essential care when their communities needed them the most. And despite their best efforts, many rural hospitals continue to remain under threat. According to the University of North Carolina, 19 rural hospitals closed in 2020. 138 have closed since 2010. And the closure of a rural hospital means people have to drive much longer distances to receive essential health care in a medical emergency when seconds count. Driving these long distances, and most certainly in the dead of winter, can have deadly consequences. And when a rural hospital closes, it really has a significant impact on both the health and the economy of the local community. When a rural hospital closes, much harder to attract and maintain businesses, teachers, doctors, all sorts of things, the impact on the community. So I'm concerned that your budget doesn't contain a comprehensive strategy for halting these rural hospital closures and building a sustainable rural health care delivery system. Can you discuss with me, please, how the department's going to address this critical issue of rural hospitals?
Senator, let me try to persuade you that there is not only an investment made in this budget, but that there is a plan here. Let me, for example, mention the $374 million that we include in the budget that would be used specifically to improve access and quality, as well as coordinate care in our nation's rural communities. We are investing more money in trying to train those healthcare practitioners in rural settings. So we're giving money more to some of those rural community facilities that could then house those future doctors, future nurses there. We know this from the studies that if you start your practice in a particular community, you may end up staying there. And so what we want to try to do is drive people that are going through medical school and so forth into some of these rural communities so that they start practicing there and hopefully they stay. There are a number of other investments that we're making, but clearly with the Provider Relief Fund support that we got from Congress, we've been able to try to shore up a lot of our community healthcare clinics, our hospitals in some of these rural settings.